Before we get started, I'd like to get over the agenda and also some housekeeping items. So this webinar will be broken into 3 parts. We'll kick off with how to prevent injuries, which is a great topic, right? And then breaking down the types of injuries you should be on the lookout for, especially with youth athletes, and then what to do when those injuries do happen. We'll also have a live Q&A at the end, but at any point, if you want to ask a question, please use the Q&A button at the bottom of your screen. We'll be collecting those questions throughout, and we'll use those to answer at the end. So let's introduce our 2 speakers. Tonight, our webinar will be hosted by Dr. Brady Fleshman and Dr. Clayton Nolly. When we say that our sports medicine team knows what it takes to compete because they're competitors too, these 2 are perfect examples of that. Dr. Brady Fleshman is a family medicine doctor who is also board certified in sports medicine. He is also one of our team physicians for the Mizzou Athletics and works with the men's basketball team, the softball team, cheer team, and the Golden Girls. He's also an athlete himself, playing football, basketball, and baseball. Dr. Clayton Nolly is one of our orthopedic surgeons. He is also fellowship trained in sports medicine. He's a Mizzou team doctor as well and works closely with our football, soccer, tennis, and swimming and diving teams. On his athletic resume, he's a football player, basketball player, baseball, golf, and pickleball. And fun fact, both of them are dads. So very well qualified for this topic. And let's get started. Take it away, Dr. Fleshman.
Thankfully, my kids haven't started having injuries yet because they're only 2. But soon, I'm sure we'll be talking about it. Kind of the reason why we're doing this is obviously as a parent, you're always concerned anytime your child is injured. We know that with certain injuries, there can be lasting issues with that, whether it be chronic instability, chronic pain, arthritis, always assessing if this is something that will affect their growth or a growth plate when there's an injury or a fracture. So these are all reasons why we are having this webinar today. And then also, developing kind of a positive association with sports. And even though that there are injuries, it's likely going to happen at some point with your child, trying to be a source of encouragement for that child and tell them that you're going to get back on the field or the court or whatever it is. Here's a few little tips that I have about preventing injuries. So we have this walk-in clinic that's all year round, Monday through Friday, and by far we have the most walk-ins end of August, September, October. Probably some of that is because we are not quite as conditioned, or at least the athletes are not quite as conditioned over the summer, or maybe they're trying a new sport they haven't tried in the fall. Also, with the type of sports there are in the fall, it tends to be a little more injury prone. But we do know that there are a few things you can do. So obviously, trying to get some type of conditioning in before you start actual practices. There's some pretty good evidence for resistance band training. So resistance training with bands has been shown time and again that it can help reduce injuries. So that's something that you can easily start doing a few weeks or a month before you begin the said sport that you're about to start. The resistance training doesn't need to be every day, just a few times a week. Also, if you know you're going to be an outdoor sport, especially in the summer, trying to do some conditioning outside to start getting your body used to the humidity of Missouri. All right, and then speaking of humidity, hydration. So I'm sure many people have seen a child go down on the field or the court needing stretched or cramped. So this is really important. We cannot emphasize this enough of making sure you hydrate properly. If you do have a child that tends to have issues with cramping, we'll talk about it in a little bit here, but one quick thing you can do is kind of like assessing their urine color, making sure that it's not a dark urine or a dark color. And then some of the things we do even for our athletes at Mizzou is getting weights before and after practice, making sure they're not losing too much weight during practice, because that tells us that they're sweating a lot and not properly hydrating. All right, and then fueling properly. So this slide we have here on the left, so female athlete triad is something that we as sports doctors have known about for a long time, decades. This is a kind of an older term because we also know that it happens in males. And so basically, what is it? Well, it's this kind of combination of energy deficiency, abnormal menstrual function. For men, this can be also in like testosterone or low testosterone, which can cause fatigue for young athletes, and then decreased bone density. So we know that for the most part, if you have someone who doesn't play a sport and is about to play a sport, or those transitions from middle school to high school or high school to college, especially like freshmen in high school, freshmen in college, are a bit higher risk for not appropriately giving themselves nourishment through calories. Um, and so this is something we really watch out for. I see multiple athletes for this every year. What are some reasons I would think of this is if I saw someone with a stress injury. So these are like repetitive injuries to the bone that can cause fractures in the bone. So anytime I see someone with a stress injury, I always want to kind of talk to the patient and kind of screen them for it. Um, if it's a female, one of the very first questions I'm going to ask them is how often they have their period. If they tell me they haven't had a period in the last 6 months, that's a definite concern to me. One misnomer that I'm gonna get off the soapbox here real quick, but birth control is not the answer for this. It's because they're under fueling. So if someone doesn't have a period because they're excessively running or just getting into sport and they've just noticed this drop of their period, you do not give them birth control to just help them have a period. You give them more calories to help them appropriately nourish themselves. So that's one of the many things. One of the new terms that we use now actually is called RED-S, so relative energy deficiency in sport. This term, we use this a little bit more now because it includes both males and females. And it also is kind of inclusive of more than just the three things listed there. So the psychological concerns that we see, the cardiovascular concerns, and the GI issues. There's a lot of athletes that I see with chronic GI issues, whether it's stomach pain, chronic diarrhea, that can be just because of malnourishment. So I could talk all day about this slide, but we'll move on. Okay, another one I could talk about for a long time. So sleep is probably something that I personally don't ask enough about, but there is a lot of evidence that supports sleep as a preventative strategy for preventing injuries. And there's a Netflix series out right now called Starting Five, and LeBron James talks about how he spends all this money on trying to prevent injuries, but the cheapest and best thing he does is prioritize his sleep. And so we know that if you deprive yourself of sleep, your reaction time, this has been tested in basketball and throwing athletes, your reaction time significantly decreases, which is obviously an issue for anyone trying to stop a ball, hit a ball, make a three-pointer, catch a ball. So prioritizing sleep is of the utmost importance. And some people will ask, how many hours should my kid be sleeping? I think it depends. I would absolutely say for a teenager, you should shoot for that 8 to 10 hour mark. For someone less than 13, more looking at like 9 to 11 hours. If your child is getting less than 7 hours of sleep, you're absolutely at high risk for injury. You're also at a 4 times higher risk of getting a cold, right? So you're gonna get injured more and you're gonna be sick more just because you don't prioritize sleep.
Then we're going to kind of break down some different types of injuries. We're going to talk about some of the kind of most common injuries that we see. And so in kids or in children, which oftentimes gets classified as anybody less than 18 or ages 5 or to 18 or so, some of the most common injuries that we see are ligament sprains, tendon and muscle strains, fractures or broken bones. Some of the most common ligaments being the ACL, which most people know about and are very familiar with, the meniscus, which is the shock absorber in the knee, most people are familiar with. Shoulder instabilities could be like a shoulder dislocation where the shoulder comes in and out of place. And then patellar instabilities means where the kneecap potentially comes in and out of place. So those are probably some of the top things that we see. Different sports are prone somewhat to different injuries, or we see more injuries more frequently in certain sports. Concussions tend to be more frequent in some of the contact injuries or some of the sports where athletes are flying through the air. So contact like football or hockey, rapid sports where they're jumping in the air for a header like soccer or flyers and cheerleading. A lot of sprains and strains, but also ligament tears in things like football and soccer and basketball and volleyball where they're running and jumping. And then the throwing sports, as you would imagine, we see more kind of shoulder and elbow issues. So things like baseball and softball and even pickleball and tennis and some of those types of things. So some of the kind of things that we see in terms of overuse injuries or where athletes are really overstressing the joint, and the kind of is in common, what we call overuse is something where they really are doing a repetitive motion or a repetitive movement or repetitive activity that stresses the joint in a similar or the same way over and over. It's most commonly seen kind of during the peak of the season, or when the athlete is really ramping up really heavy. And if they haven't had that ramp up period, or they haven't been training well in the off season, then it's more frequent and more easy for this to occur. So common kind of overuse injuries that we see, again, can be strains and sprains, but also stress reactions or even fractures, injuries to the growth plate, and then various forms of tendinitis, which is inflammation of the tendons, and those sorts of things.
One thing I was just gonna add on here, this is like, you're gonna see this in baseball season always, is these, what we call little league elbow, little league shoulder, which are stress injuries to the elbow or the shoulder. There is a really nice free website. It's from the Major League Baseball. So it's called MLB Pitch Smart. It's a free resource, and you can literally put your child's age and it'll tell you exactly how many pitches and they should have. And then if they throw X amount of pitches, how many days off they should have. And if there's a tournament, how many days in a row they can pitch. It's got a lot of good information on there. So I always try to talk to parents about that resource, because it's inevitable that every year I'm going to see these stress injuries in the elbow and shoulder for baseball. I don't necessarily see that as much with softball. Different mechanics. One of the popular things, I'm kind of jumping down here, is in sport specialization. So there's been a lot of data repetitively that has said, the more different sports you play, the better. The only kind of sports things that I can see playing more than one that can be kind of repetitive is if you are a pitcher and then you play quarterback. While that's not the same exact mechanism of throwing, it is kind of the similar phenomenon of kind of the way you're torquing your elbow and your shoulder. Um, so, if you are a single sport athlete, so I'm just going to use baseball again. The Major League Baseball Association recommends 4 months of non-throwing activities, with at least 2 or 3 of those months being consecutive, just to give yourself some time off. But we know, and it's like, I remember growing up, like my football coach always making all of us run track, right? Just to try to work some different aspects of our body, keep in shape, stay conditioned. So there's a lot of benefits from not specializing in sport early. And even, there's been a lot of studies following these people to a professional level, and it's not necessarily the ones that played one sport from age 7 to 18 that are the ones playing professionally. In fact, they have a lot higher risk of injury that could be season ending, which could really affect their college and professional likelihood. Clay, I don't know if you have anything to add to
Yeah,
that.
I think if there's one slide that anyone that's on the webinar takes away from this tonight, it's this one is one to consider, because I think there's a lot of pressure nowadays for both parents and kids alike to start to specialize earlier and earlier, or to start to play just one sport year round, or even play maybe more than one sport, but especially start playing these sports year round, and start playing travel or competitive sports here and there, which is okay, to do some of those things, but there's a lot of pressure to do that, and a lot of these athletes, when that's the case, they don't ever have a relative amount of time of rest, or the appropriate time of rest that they need from certain sports. And early sports specialization, as Dr. Fleshman said, has been shown to be linked to earlier injury, and particularly earlier injury for the repetitive type of injuries that we see. So baseball is the example that he gave. We see a whole lot more elbow injuries now than we used to, and a lot earlier ages. So it used to be that people tore the ligament in their elbow that everyone is probably familiar with, that requires the quote unquote Tommy John surgery. It used to be that didn't happen until they reached the professional leagues. Nowadays, now we see kids that are even 13 and 14 years old are tearing that ligament in their elbow, and it's because they've been pitching year round since they were 8 years old. And so the reality is, especially as athletes are growing, and especially as they're going through adolescence, they need time to rest certain portions of their body. And even if they're playing a different sport, or they're training in different things, it trains different muscle groups. It trains the body differently. It balances out their muscle groups appropriately. And so I think if anybody takes anything away from this webinar more than anything else, it's that, number one, athletes don't need to specialize at an early age. But if they do, if they love just one sport and that's all they want to do all the time, which is okay too, they still need periods of appropriate rest and periods of time off.
Hey, Clay, can you comment on the like the 28 rule that the NCAA has?
Yeah, so I mean, that's a great example. So like the NCAA, they actually have a time limit on the amount of time that athletes can practice. And so, Division I level, we're an SEC school. These are the elite of the elite athletes in the NCAA and in college sports. And even though they are only playing one sport, most of them, and they're on scholarship and they are there primarily to play that one sport, they still are only allowed to practice 20 hours a week. And devote up to 8 hours per day, but 20 hours a week total. And so if you think about that, like, you hear stories about young adolescent athletes practicing a certain sport 4 and 5 hours a day. That could be as much or more than what Division I full adult athletes are doing it. And so you have to kind of think about that as, when your athletes are, playing a lot of different sports, or especially if they're playing one sport and spending a lot of time doing it kind of all at once.
A couple things that I see frequently or questions asked about is our risk of re-injury. I think it depends a lot on the injury itself. Um, is there's always the question of, and I think that's kind of where we come in handy, is just explain to you what are the injuries that you're quote unquote safe to play through versus what are the ones that you need to pull yourself out, because there are certain injuries. I mean, every athlete is different. Of course, like I want to know if they're in season, out of season, what do they have coming up that's important to them, because obviously there's a lot of club sports and things like that. So even if necessarily they're not in season with school, they might be with a certain club sport. So those are some of the questions I like to ask to kind of assess whether this is something that they should rest from versus is this something that they can play through or get through this XYZ tournament, which is important for recruitment. Um, so yeah, it just kind of depends. I don't know if Clay, if you have anything else to add about this.
Yeah, no, I mean, I think that's a great point. I mean, that's probably some of the, after an athlete is injured, probably one of the most, and probably the most common question parents will ask as soon as they come in is, well, how quickly can they get back? Just like you were talking about. And making sure they regain full range of motion and full strength, and we do everything we can to make sure they don't have a re-injury and don't have a new injury or compensatory injury, just like kind of you were talking about. And that's very patient specific and athlete specific. But those are some of the basic parameters that we are always looking for and that need to occur before we would return an athlete to play. Yeah, so some of the things, so parents also always ask, what's the difference between, how do we know if my athlete's actually injured or not, or when they should be seen? And so some of the things to kind of look for in terms of like kind of their quality of their pain or their type of pain. So kind of what quote unquote normal soreness if they play and they get sore the next day, or they even get sore after a practice or a game. If they have short bursts of discomfort, or even just some generalized aching, oftentimes that can be related to normal soreness, either after the practice or even the next day after a hard workout. A lot of times, athletes are going to have some soreness if they do a new activity or they do a new workout or start playing a new sport for the first time. But usually it gets better within a couple days, especially if they take a little bit of time off. Injury pain, it tends to be much more intense. It's often a sharp type of pain or a sharp shooting pain. And in many cases, if it is a true injury, then it oftentimes doesn't go away or it persists for a long period of time. And then certainly if there's associated swelling, particularly swelling of a joint, or if the athlete has difficulty bearing weight on a limb or difficulty walking for an extended period of time, that would be something that would be more concerning for a potential injury.
One thing I always say, you're talking about swelling, I always say the knee is good at telling us if something is wrong. And so anytime your knee is swollen, you should come in and be seen. And any young athlete with a swollen knee should always be a reason to come in and be seen, just to make sure everything's all right, even if there's not necessarily an injury that you recall.
Dr. Fleshman was just talking about just then swelling or visual inflammation. If there's a lot of warmth or redness, that typically is a little bit more concerning. And as I said earlier, changes in gait or form, so difficulty weight bearing or difficulty walking, or if they're really favoring one side a lot. And obviously, if someone takes a hard slide tackle or something, they may get up and limp initially first, as it takes them a minute to kind of recover. But then they can get going and running again. That's different than if someone takes a hard slide tackle and they cannot put any weight on their ankle or their knee, and then their knee or their ankle gets really swollen and gets really big, and they can't put any weight on it still hours later. That's obviously something much more concerning that may need to be evaluated.
Couple of things regarding muscle pain and muscle tightness or stiffness. So there is something called delayed onset muscle soreness. So that's like, you commonly think about maybe you haven't done a leg day in a while, and then 2 days later you're walking very stiff because your legs are sore. So that's called DOMS, or delayed onset muscle soreness. Fairly normal phenomenon. What we don't want though is for you to feel these sensations or cramping with very minor movements. So anytime, just thinking about an athlete I saw recently, like they said, when they went to do their hair, when they went up, they felt immediate cramping in their chest and in their arms after a pretty significant workout. So there is something that's more serious with cramping. It's got a long name. It's called rhabdomyolysis, and that is a very serious type of breakdown of muscle. The only thing that an athlete or parent would notice would be the change of the color of the urine. We usually say it's Coca-Cola colored or tea colored, so it's a very dark, and it's actually breakdown of muscle and blood in a way that is in the urine. And so that's always a reason to be seen. Um, Moving on to this next one about fatigue. So fatigue can be a sign of what we were talking about earlier of that female athlete trait or relative energy deficiency in sport. So if you're noticing that your child's continuing to complain of being tired all the time, it might be because they're not getting adequate rest. They might not be nourished well enough from a nutrition standpoint. So making sure they're having enough food intake. I don't really know if there's a perfect place to talk about this, so I will now. People often ask me like, how much protein should my child be taking in? There's no hard and fast answer to this. A very easy answer, which is not all encompassing for everyone. I will tell someone to take their body weight, divide it by half, and that's the absolute minimum of protein they should take. So let's say we have a 200-pound football player here, and they want to know how much protein. At a minimum, they should be consuming 100 grams of protein minimum. Obviously, it changes by the sport. Also, carbs are good, so eat carbs. I think there's some infamous diets like the keto diet, which has its definite positives for certain things, but from an athletic standpoint, you need those sugars to break down so you can utilize them in sport. So it's important to have adequate fat, protein, and carbs. And then, obviously the last one we have here are the emotional changes. So just beyond athletics, right? People have tests, they have family issues, they have relationship issues. So whenever an athlete is more depressed, more anxious, they do have a higher chance of having injury. So just some other things to watch out for.
So next thing we're going to talk about is kind of what to do if there is an injury, if you see some of those warning signs that we just listed. Okay, well, now what? Now what do I do next? So this is kind of a nice little summary slide. May be helpful to kind of take a screenshot of it for the parents that are on, just so you kind of can maybe refer back to it if you want to. But this kind of tells you kind of where to go and when based on the type of injury that your son or daughter or athlete may have, and differentiates between kind of major and minor injuries. So because we get this question a lot too. When should I go to the emergency room, or when should I just come into clinic, or when should I be seen? So emergency room is for, pretty significant injuries typically. And so that's something, if they break their arm and it's clearly very deformed, then that's something that would go to the emergency room. Same thing for a dislocation. If their shoulder is dislocated and can't be put back in, or any other joint is obviously dislocated and out of place or out of the socket, and that probably needs to go to the emergency room so they can help you put that back in if you don't have access to someone who can help you there on the field or help you there right away. Severe head or neck injuries. We have seen this very recently, even in our high-level athletes, with a neck injury in a football player in the game last weekend, and a neck injury in one of our Mizzou basketball players, even just very recently last week, or within the last week. Both of those athletes we took to the emergency department. And so that they could get a full evaluation of their head and what we call their cervical spine, their neck, to make sure that they didn't have broken bones or any sort of damage to their spinal cord and other types of things. And so those are kind of major injuries that if that occurs, or you see that occur, then those should be taken directly to the emergency room. Urgent care, people ask a lot about when should they go to urgent care to maybe potentially avoid a long wait at an emergency room. If they have a laceration or a cut or something that think probably is going to need some sort of sutures or stitches to be sewed up, urgent care can be great for that. Sometimes you can get in the urgent care much quicker than you can in the emergency room, particularly if it's not for some sort of major head or neck injury. Sometimes in the emergency room, they're treating life-saving measures for patients that need life-saving measures, and so a laceration may not be seen quite as quickly in some cases, but in urgent care you can get in pretty quick. So a cut that needs stitches or staples could be a good place to go to the urgent care. Any sort of immediate pain needs, if they're having pretty severe pain that's not controlled with Tylenol or ibuprofen or ice or elevation or some of those types of things, sometimes the urgent care can be good for that. If it is some sort of a musculoskeletal injury, so say they hurt their arm or they hurt their knee and their knee's swollen, like we talked about earlier, most of the time they can do x-rays, but if those x-rays are negative, they'll generally refer you to a sports medicine specialist or a sports medicine physician from there. And so for a lot of the musculoskeletal type of injuries that your kids are going to have most commonly, we recommend coming to like the walk-in sports injury clinic or potentially seeing a sports medicine provider, or your physician if you're already linked up with a physician or have previously seen a physician for other previous injuries. And so that kind of gives you kind of a direct access immediately to a sports medicine physician. Our walk-in injury clinic is open Monday through Friday all year long. At 7, it opens at 7 a.m. in the morning. Don't need an appointment to come in or be seen. If you get hurt the night before in practice, you can just walk in the next day at 7 a.m. and be seen by a sports medicine trained physician. So I think that's really helpful. In the fall, it's actually open on Saturdays too to accommodate Friday night football games. And we have X-ray, DME, which is bracing durable medical equipment, and all those things basically on site. And so athletes get pretty much an immediate diagnosis or even an imaging right away or bracing or casting, crutches, anything that they might need pretty quickly. So that's a nice resource and avenue. And for most musculoskeletal injuries, again, especially ones that don't need emergency treatment right away, that are more severe or don't need some sort of cuts or lacerations fixed up right away, right after the injury, the walk-in sports medicine injury clinic is really helpful and really beneficial for those types of injuries.
Yeah, I was just gonna make one other comment is, with the sports injury clinic, and Clay said some of this briefly, but we do have like athletic trainers as our staff support. So not only do you get seen by the sports doctor, but then you also get the training, rehab, and the exercises by someone. In fact, the athletic trainer that works our walking clinic was the athletic trainer for Mizzou football for over a decade, right? So he's worked with elite athletes to help you get back to sport as fast as possible. Another thing that is probably not well known is a lot of times insurance is actually only cover one type of brace. And so this isn't always the case, but it is a problem we run into sometimes is they get a brace from the urgent care or ER that may not be the best brace for them. And then we may have a hard time trying to get them another brace. And so it's just another reason to me, I think the emergency room absolutely has its spots for sports injuries. The urgent care, I think, can be used for like lacerations and those type of things. Obviously, his pain is not managed and it's 7 o'clock at night and you need to go somewhere, but you don't think it's emergent. I guess, yeah, urgent care would be the spot. But if it can wait till 7 a.m. the next day, you're going to be in good hands seeing just a sports medicine doctor and walking out by 8:30 with treatment, diagnosis, and plan.
This is kind of, we were kind of just talking about some of the kind of minor injuries. And so parents will say, okay, well, how do we know, or what should we do if they do have a minor injury? We think maybe it's an ankle sprain, but we're not sure. So a lot of those types of injuries can be at least kind of initially triaged or treated at home and maybe wait about 24 hours to see if swelling develops or see if their pain improves. Can use ice for pain and inflammation. Heat if you want to kind of relax tense muscles. And then obviously kind of the classic rice that people talk about: rest, ice, compression, with an ace wrap like you see in the picture there, and then elevation. Pretty common things that most people have done for a long time and know about if they've ever played sports. Sometimes over-the-counter pain meds, obviously ibuprofen or Tylenol or those types of things can help. And then, if you get to the next day and there's a lot of swelling or there's still a lot of pain or they're having inability, difficulty weight bearing, any of those types of things like we've talked about, then that's probably a good time or a good time to then think about coming to the walk-in sports injury clinic or making an appointment to see a sports medicine physician to get a further diagnosis.
Non-surgical options for patients, particularly the youth sports injuries, is the several things listed there. Now, I actually feel like my biggest importance or job for the athlete and the parent is letting them know the severity of the injury. Is this something that we can work through the season? Is this something they can play through with rehab, bracing, sport modification, as it says, or is this something more serious? We can get quite creative in our modifications and our braces or casts that we use for certain sports. Obviously, physical therapy is a very common thing that we'll recommend. A lot of times, what I like to do is have the athletic trainer give you a at-home exercise program, because obviously you're not going to get into physical therapy tomorrow. So you can start. It's not like you have to wait 2 or 3 weeks and just do nothing and let that injury sit if it's still going on. So you immediately walk out of a visit with some ideas for rehab. Commonly people ask like, well, what's your most common rehab treatments or exercise program? So there's two or three that come to mind. One is called, and you can Google this, and there's a PDF right online. It's the same PDF I print off for my patients. It's called the Hip Myrtle, Myrtle, Hip Myrtle routine. This was created by physicians through Nike, and it is something that you can use. It was meant for runners, but it's really working on hip strengthening with some core strengthening. A lot of lower extremity injuries, particularly knee injuries, but anything below the waist can be most commonly from weakness in the hip and weakness in the core. I'm kind of referring back to baseball because it's on my mind, but um, when I see someone with elbow shoulder injury, the very first thing we're going to do in rehab while the elbow or shoulder rests is hip and core strengthening and mobility. So the hip Merle routine is very common. There's also something called Core X, free on YouTube. I love giving free resources. So Core X is a 5-minute video of core exercises, actually by, I think, the same physician that created the hip Myrtle routine. And it is very intense. It's some serious core work because they work both the kind of like the outer abs, the inner abs, and your back or your posterior chain. To help get the core strong. You'll notice whenever you see me, we commonly talk about hip core mobility and strength. Clay, this might not be a bad idea for you to mention the FIFA exercises for the ACL prevention. That's another thing that we'll talk about with athletes too.
Yeah, that's just another one that's, our soccer athletes are frequent injury flyers, and so there's the prevention protocol, also Googleable. It's called the FIFA 11. For those people that are involved in soccer, they know what FIFA is. It's the World Soccer Organization. FIFA 11, the number 11. It's 11 exercises to help strengthen and balance the muscles above and below the knee and around and the legs and the core appropriately. That's been shown to help reduce injury risk, and in particular, actually reduce ACL injury risk. And so the FIFA 11 is another great injury prevention protocol.
One other thing I'm going to add on this slide, that last one about injections, it's not super common to do injections in youth. Do we do them? We do occasionally. It's very specific to the injury, of course. But I have additional training in ultrasound guided injection. I think I'm pretty good at keeping people's pain low while we do it. And so that is an option, although it's not a super common one we have to do.
All right, so some of the treatment options for surgical injuries, we mentioned kind of some of the more common injuries that we see that oftentimes necessitate surgery, probably the most common ones being ACL injuries, meniscus tears, patella, which is the kneecap dislocation, shoulder and hip labrum tears, and then certain fractures or broken bones. At the Missouri Orthopedic Institute, we do a lot of different surgeries, and most of which are very minimally invasive, some of which we've developed specific type of techniques to minimize pain and minimize postoperative swelling and improve early postoperative rehab. We do a technique called an all-inside ACL reconstruction, which uses just very small, minimal incisions instead of big open incisions, which again minimizes postoperative pain, postoperative swelling, and really helps patients get going in rehab much quicker. And for the vast majority of surgical things that we do for musculoskeletal injuries or athlete injuries, the vast majority of them are outpatient, meaning the athlete goes home the same day. Very few athletes ever have to stay overnight in the hospital, which again is nice because then they get to be home with their families and then start recovering and rehab kind of in the safety and the comfort of their own home. And then of course, after, whether they have a surgery or whether they don't have the surgery, or when we develop a rehabilitation plan, again, as we talked about before, kind of the number one question is always return to sport, or when can they get back to their sport. And I think it's important to note that return to sport treatment plans, whether it's something as simple as a low-grade ankle sprain or whether it's something complicated like an ACL tear or even more that's going to require a lot longer time to recover and rehab, it's important to personalize the treatment plan and then the return to sport timeline to each individual athlete. And so well, that's where having the advice of a sports medicine physician really can come into play and really help a lot. And then involving multiple different people who are involved in athletics, whether it be athletic trainers or physical therapists, or a variety of different subspecialty physicians, even when necessary. That's all very helpful. And we have all of those kind of touch points and access points available to athletes. And then based on their individual injury, we then tailor their return to sport based on their age and their sport and the degree and severity of their injury. We do a different number of different things at the Missouri Orthopedic Institute with sports-specific testing and functional testing, and have some different types of technology aids that we use to evaluate patients' gait patterns and running patterns and throwing patterns, and some of those types of things as well that can help us aid in getting patients back to their sport as quickly as possible, but in a safe and efficient manner as well.
One of the things that commonly get asked is if someone's from out of town, or they're driving a long ways and trying to get them a gait analysis. So it's really not uncommon for me to see someone and let's say I'm managing them for a bone stress injury, like what we call like a stress fracture in their lower leg from too much running. As they begin to heal, and their bone starts to heal, we can set up like same day evaluations for you to see me and then go have a gait analysis to see how your running technique is. There's also a lot of things I can just tell people that can help with reducing running injuries. Another very common rehab strategy is our throwing clinics. So we have a couple of different places that can do that. We also have some packets for throwers. There's something called the Throwers 10, which is a good exercise packet that I've given out before for people that are coming from out of town. We also see concussions, and so we have several different specialists here at MOI that can evaluate concussions. Obviously, that is not an uncommon thing to see in the sports walk-in clinic. More commonly, it is the question of, does my child have a concussion or not? So helping make that initial diagnosis or not. Concussion evaluations are very quite lengthy. There is at a minimum of 40 to 50 questions that are asked and exams that are taken. There's a very thorough exam of one's eyes. I always say with concussions, the eyes can tell a lot of the story. And so it's a very thorough analysis. And then making follow-ups after concussions. Sometimes you'll follow up with the physician that you saw at that sports walking clinic. We also have a neurologist on staff that can see and evaluate concussions. And so you have lots of different availabilities here at MOI for your concussion management.
Awesome. That is the end of our webinar. We're going to get ready for our Q&A session. So be sure to enter those questions at the bottom of the screen. And while we're collecting those questions right now, just a reminder, we mentioned our sports medicine injury clinic quite a bit. So here's the information. Take a screenshot if you need, look it up on our website. But again, that 7 a.m. Get in and out before work or school, definitely at MOI. So we also have a couple of resources. We talked a lot about a lot of topics here, and we've got some really great subject matter experts on all of those. So how to prevent those injuries, exposing your kid to multiple sports. We've mentioned that quite a bit. How to treat minor injuries at home, and then also some tips to ease into sports and activities as you go. All right, so let's begin our Q&A. We've got a few questions that have come in. One of them, are there any sports equipment that can help prevent injuries that you two would recommend?
The one I immediately think about, actually, it sounds simple enough, but mouth guards. So mouth guards have been well proven in hockey specifically, but football also to prevent any type of dental or yeah, primarily I think it was primarily all dental things that were improved. Clay, can you think of any others?
Yeah, I mean, so we get a lot of questions, a lot of times specific like to shoe wear and things like that. A lot of times parents will say, what's the best shoe for my soccer athlete or my football athlete? And the short answer is the same as the long answer, which is it really is specific to the individual athlete and the type of foot that they have, or the type of sport that they play, or the frequency that they play. And so there isn't necessarily typically one specific brand or one specific type of shoe that's best for soccer or best for football. It's really whatever shoe is best for the individual athlete. And oftentimes athletes will figure that out over the course of time. Hopefully it won't take an injury for them to figure that out, but oftentimes they figure out what they can run in comfortably, and what they can play in well. One of the biggest things that we always tell athletes is to just try and make sure that the shoe's not too terribly tight or too terribly form-fitting. You want it to be just snug enough and fit well enough. But it doesn't need to be over constrained or too incredibly tight, which can be easier said than done for our younger athletes who, if they're anything like my kids, grow out of their shoes before the season's even finished one season through. But that's one of the things. We get a lot of questions about helmets for football athletes and stuff. The NFL spent like almost $1 billion in the last couple of years just on concussion and in a sub-analysis of helmet research, and that sort of thing. And there's always kind of ongoing changes in helmets, and people talk about things called skull caps now, which are padded portions of helmets and all these different things. But that's kind of always ever changing. But again, it's something where if you want it to fit the athlete's head well. You don't want something that's going to be loose or where their head could potentially flop around or twist around or turn in the helmet, because that could be a potential risk for an injury, or when they get hit, or if their head gets hit or head or neck gets shifted or turned. But those are some of the common questions that we get with those particular type of shoe wear and helmet wear.
One comment on the shoes that you were saying, for youth athletes, I don't. There are exceptions always, but I don't generally recommend like custom orthotics. I don't know about you. There's some pretty good orthotics you can get on Amazon. So the two most common ones I'll talk about are Power Step orthotics and then Super Feet. So those are two pretty high quality orthotics that you can get yourself without having to pay $300 for custom ones, because yeah, your kid's likely to grow out of that very soon.
Wonderful. We have another question. Does injury prevention advice change based on age? For instance, I have an elementary school kid and a middle school kid. Should I be telling them different things?
Yeah, I would say yes and no. I mean, I think the same philosophies are still in place of kind of the things I talked about, right? So injury prevention, what is that to me? That's appropriate acclimation to sport. That is sleeping well. That is eating well. So not just, juices and sodas and things like that, making sure they're adequately hydrating themselves. However, we'll use the pitch smart thing for baseball athletes. How many throws an 8-year-old can throw is way different than a 13-year-old. And so, yeah, if you have a child that's a different age, and they're both playing baseball, they should not be matching each other pitch for pitch.
Yeah, the basics are the same across the board as in terms of the basic generalities that Dr. Fleshman mentioned: nutrition, hydration, sleep, recovery. Those are all, everybody needs all of those things and needs them well. Certainly by some ages more than others. There's different types of quantities, and as he mentioned, the quantities and level of certain things. As he mentioned, protein, for example, is one earlier. And those types of things change as the athlete gets older. Also, as the athlete gets older, the type of injuries can sometimes change a little bit. And so once they get into the teenage years, their growth plates start to close and there's less risk of growth plate injuries. But obviously for a much younger child, growth plate injuries are much more frequent, and may need an evaluation or may need to kind of be seen or evaluated further. And so we worry about those types of injuries with a little bit more frequency at younger ages than older ages. But the general kind of basics of injury prevention stay the same kind of generally throughout. It's just the amount and the time that they require starts to differ over time.
So another question. My kid keeps getting injured. What are signs that they should stop sports?
I think that I will take this. I don't know if you have anything to add after I say anything doctrinally, but I think it varies wildly based on the actual injury, right? So there's a big difference to me of someone getting recurrent bone stress injuries because that could just be we're not thoroughly evaluating the underlying factors, and we need to, and if we get those better, I can promise you those injuries are going to stop. Um, Rarely do I tell someone you shouldn't play this. I can't even think of an example off the top of my head of someone that had just recurrent different injuries. I said, you need to stop playing that sport. It's just not something that a sports medicine doctor would want to say. I'm going to particularly talk about concussions even. So there is no magic number of concussions that once you have X concussions, you cannot play that sport again. It's really more of an evaluation for concussions of how long does it take for them to recover? Are they fully recovered after each concussion? Um, the type of blow to the head that's causing the concussion, was it something very minor like your little brother threw a basketball to your head from 3 feet away at not very hard and you got concussed, or was it a kickoff return and you got hit really hard? Because I mean those are different mechanisms and forces applied. So I hope that answers that question, at least from my end.
Yeah, it's
So we have
pretty
another.
unusual that an athlete would be told to stop playing a sport, or especially if they're a younger age or younger athlete, if they're having kind of different types of injuries, an ankle sprain here and then a wrist sprain there or something like that, or kind of a random, broken bone. At some point, most kids are going to have a broken bone potentially at some point, especially if they play a lot of sports or they're out on the jungle gym a lot or whatever. Those types of things happen growing up. Certainly, if they have a recurrent injury that keeps happening over and over, that definitely may be something that needs to be warranted to have a little bit more in-depth evaluation or workup potentially, and definitely something to, work with a sports medicine type physician with to further evaluate. It doesn't necessarily mean that they'll have to stop playing their sport, but certainly kind of getting a definitive diagnosis, a definitive hopeful treatment plan so that that injury recurrence ceases would be important.
Wonderful. We have another one. So one of our participants has a 16-year-old teenage boy that's in baseball and football. Last year, his season in baseball was ramping up. His athletic sports trainer from school told us he had an AC joint tear. Is that something he can be fixed himself over time, or does he need surgery?
So, I mean, you probably need a little bit more information. AC joint injuries can happen a number of different ways, and have there can be a number of different types or grades of injury. And so, generally speaking, relatively low grade, or what we call a low type, AC joint injury can heal over time with appropriate rest and non-surgical or non-operative management and limitations in certain types of things like heavy weight training or heavy overhead lifting or throwing. If it's a higher grade or higher injury, in some cases that can potentially need surgery, but usually most people know that because the AC joint or the clavicle may be displaced, or they may have a bump over their shoulder, or pretty significant pain and dysfunction. And so it kind of depends a little bit more on some of those types of factors, or maybe a little bit more details about the injury itself.
Football's a really common for that injury, isn't it?
Yeah, we get multiple of them every year.
We have one more question. As a parent, how can I help balance my child's desire to push themselves hard in their sport, but also not push themselves too far?
I mean, first off, I mean, I think that it's awesome if you have a child that truly loves the sport that much, right? So that call that a success, and that apparently he or she gets positive feeling whenever they're doing that. Um, I think the biggest thing, and again, it depends on the sport, but pretty much every sport shouldn't be played year round, or as we talked about, like the sport specialization. So, I mean, if a child loves baseball, I'll say they love baseball, but they take 3 months off to play basketball. Um, let them enjoy their baseball those other 9 months. I think the biggest thing is just making sure that they don't do the said sport all year round with the same type of motion.
Yeah, I mean the biggest thing that I think parents need to always know, and we remind parents often, and I'm a parent of kids who play sports and love sports, and I grew up playing tons of sports at the competitive level and stuff. But the reality of it is less than 1% of college athletes go on to play pro, and an even smaller percentage of high school athletes do. And so So, you know, the number of kids that play sports, even if they specialize, that are going to end up being a professional athlete is really, really low. So the reason to play sports in general is for a lot of the other things, for activity, for exercise, because they like it and because it's fun, to learn teamwork, to learn leadership, to learn resiliency, all the different things that sports are awesome for. But I think, you know, sometimes some of the things that we see as parents start to push their kids a lot, and that can get a little bit worrisome, and that can get difficult. Now the question is, if the kids really get after it, then that's fine too, and that's great. And so, you know, and so you don't necessarily want to hold them back, especially if they really enjoy a sport and they really want to play it a lot, to play with their friends and things like that. But usually kids are pretty resilient, and so, you know, if something happens, then you know, then you can help them kind of dial it back and that sort of thing.
One last one, unless more come through. If my kid does get injured, how as a parent can I help them mentally get through that? What do you see with your patients?
Yeah, I mean, the quickest thing I always say is positive. Well, I want to say positive reinforcement, and being a positive, but the loving and caring parent for the child, being with them at that when they're sad, being supportive of them also, and then, you know, continuing to be their like biggest cheerleader during the rehab process. I mean, Dr. Noli will comment, and I tell patients, you know, when people tear their ACL, that can be quite the news for someone. But um, a small the surgery is important, but an even bigger part of it is the rehab afterwards, right? So we don't see these people every week after their ACL surgery. So you have to be there to be supportive for them, and be a cheerleader for them and encourage them.
Yeah, especially for adolescents, you know, adolescent athletes, a lot of times the first time they have an injury, you know, it's the first real kind of tough thing that they maybe have encountered in their life, potentially, maybe not always, but sometimes. Or it's the first time that they maybe have to be away from their friends, or they don't get to do the activity that they love doing with their friends for a long time. And that can be tough emotionally and tough on them. You know, we talk about the difference between when it's okay to give tough love and when they just need support, and really need you to kind of just be there for them and help them through it. You know, if they just kind of fall down the field and they're kind of in a whiny mood that day, but if nothing's really significantly hurt or significantly injured, you know, that's okay to give them a little bit of tough love then. But if they've got a true injury, or especially like Dr. Fleshman said, you know, if they need a major surgery and they're going to need a prolonged rehabilitation course, they're going to need a lot of emotional support and a lot of help and a lot of encouragement more than anything else, so that they can really attack their rehab and really get back to doing what they want, and getting back out there. And so encouragement is just really the kind of the biggest thing. I think anybody that's a parent, is probably a veteran or well versed in encouragement at some point or another. But certainly after a sports injury, encouragement is a priority.
Wonderful. Thank you both so much. That is the end of our Q&A. That's the end of our webinar. For those participating, we will send follow-ups with recordings and answers to questions as well. So we look forward to getting that information out there and helping your kids not get injured, or better if they do. So thank you all.